squirt, look like baseball shirts.
Okay,
like,
you are
perfect
now
product
live, my friends.
Perfect. Product placement. This live brought to you by Ruby Red Squirt.
We can do that.
Ruby Red Squirt. It's what keeps our office
It's what
running.
keeps Tiffany going.
Okay, remember that you're up here for Instagram.
We need to remember that. Remind them. You guys are a foot higher. You're up there.
Are we able to lower them down just a twitch?
Come up here with me.
I just went where Bailey put me.
Oh, come up here with me.
I can lower you.
Oh, thanks for not pinching your finger.
That would have hurt. See, but then I have this all cute in the
That
background.
was really cute.
See? No,
Okay.
Stuff for you.
Say what's up to your friends on Instagram.
What's up to the friends on Instagram?
where? I just realized.
I know. So Daisy just
Look at
said
that.
maybe make them trade places. So
No,
when we look
we
at the
can't do
screen, but now it says keep your gums. But I told Bailey, I'm like, we can't
You
sit on the
can't
other side.
sit. No, I can't.
We can't even
sit
walk.
on that
We can't even walk somewhere with you on the other side of me. It is the weirdest
I
thing.
have to be to your left. We're sitting on an airplane one time. We both looked at each other and went,
Wow, we can't.
got up and switched. We don't even decide who sits by the window. It's just I have to be on your left.
Yeah, it's so weird because we stand and do surgery for 8 hours, six
For
lately,
years.
for years,
This
and
isn't-
she's on my left.
yeah.
And so
I've got the sound on the computer. Sorry,
Oh.
you're gonna have to go on the lower right and turn the sound off on the computer. Like just on the, I don't know, like click it
Yeah.
on. Yeah.
I was like, what is going on?
We were showing a patient a video the other day, so I turned the sound on. There you go.
Okay, sorry, just making sure we're all.
So we're still 4 minutes early. So the fact that there's not a single person here doesn't hurt my
That's
feelings
great.
terribly.
Oh, now there's 2 people.
Oh, 2 people.
Oh, it's my
What?
mom and dad.
It's our moms and dads. That's amazing. That's so funny. We were just talking about how then the second person's gone again. So we're just talking about how
My dad.
Tiffany can't sit on or stand even on my right
Will
side.
Walk on your.
Yeah,
right
we'll be walking
or-
somewhere and I'm like, walk over there.
Well, it's like, and we all we bump into each other.
Yeah, it
I'm
just
like,
doesn't
oh,
work.
what are you?
You're supposed to be on that side of me. I can handle you on that side of me. So right now on the computer screen that we're looking at, it has it reversed. So I look like I'm on the other side, but if not, then the viewers at home couldn't read our cute sign.
I can't figure out
to
where my
keep your
head
gums.
needs to go.
I know it's
so
weird
that
that
I
it's
don't.
opposite.
Well, I just don't want to cover up your name. Like,
Where's my name?
no,
Oh, on the
there's
sign? Oh, don't
I have
cover my name.
I have a fat head.
Don't
Now,
slap.
now I look like I have a
Don't slap.
plant coming out of my head.
No, I had a plant coming out of my head one time. Your dad made fun of me.
Oh,
on
I
a
know. My
post.
dad's like, ooh.
Somebody commented on Instagram and said, I'm so glad to know this is a real page. Thank goodness. I need a miracle done.
Oh,
This is a real page,
We're real.
and we work miracles every day. So
oh,
welcome. For our Instagram attendees, the camera is a foot higher than the camera down here. So
I'll pick you up and show you.
I will work on
there we go.
trying to look up and make sure I was.
That's their other camera.
Yeah, I'll
I'll
try
show
to.
you.
I'll try to give some love to the Instagram attendees today too,
Look-
to watch up
Look
there.
up. Look at the ones.
Daisy Terry, my favorite people. Oh my
Aw.
gosh, I'm so glad to be on your favorite person list. Well, we have.
Here's what's funny on Instagram. They
Yeah.
can also see below.
Listen.
Oh, is that the view from Instagram over there?
Instagram.
Turn that towards me. That's kind of fun.
Oh, you want to be able to see
Yes,
it?
I've never been able to see with it.
I am so
Oh my
glad.
gosh, you
I
can
am
see all
so
of me.
glad I didn't do like a newscaster thing and not wear pants today.
Newscasters don't wear
All the
pants.
time.
Hey, that's
the
not
ones
true.
that sit at the desk.
That can't
they
be
just have, like,
true.
a pair of shorts on.
There's
they
no
don't
way
have
that's
like
true.
their suit bottom on.
So how come that's so
Happens all the time.
delayed?
It's live.
'cause it's Instagram.
However, it has to go from there to their phone, and it's always going to be
It's
a little
just-
bit delayed. It does that on Facebook.
That's
Instagram.
interesting.
Yeah.
All right, I don't want to see it. That shows way more of us. That shows like
Look how tan I look on Instagram.
I need to go on a diet.
Oh.
So on the Facebook one, it shows us from my name on my shirt up.
Yeah.
But on Instagram, y'all are seeing all of us.
Well, no.
Oh, Irish Black said, "Thank you. I'm a DJ here in Vegas at Dre's.
Oh,
The one who said
sweet. You need
that
a miracle?
They need a
Dude,
miracle."
Bro,
okay,
call
all right.
the office.
DJ at
Oh,
Dre's.
I'm Sir Black. Oops, what's wrong? I said Iris.
Oh, Sir Black. So here's the thing. Cool. Welcome to the show today. But I want you to know, I can't say their names, but we have helped many
Cool people.
cool people in maybe your same industry in Las Vegas. And
That was a really good way to say that. Yeah, that was a really good way to say
so, yeah, we'd be happy to help you out. So that's super cool. Yeah, we're definitely here in Las Vegas. We're over in kind of like the Summerlin area, technically we're in Summerlin, but we're the very north.
I feel like
End
we
of
could
Summerlin.
throw a rock and hit the Summerlin sign.
Well, we can. It's in our parking lot.
But neither one of us can throw a
I
rock
can't
that
throw a rock
far.
that far. Yeah, we're on Lake Mead and Buffalo here in Vegas. So
Neither one of our shoulders will allow us to throw a rock.
yeah. So yeah, we're glad you joined, but yeah, we're happy to help you out. We have lots of patients
Cool
who
people in cool industries.
we can't name that are in cool industries and entertainment, and some maybe in your same field.
Is your mic on? Bailey, his mic's not blinking.
Yeah,
green.
it's green.
It's green on his side, yeah.
Oh, it's just
He's
not
all
green
good.
on my side.
It's blinking.
Oh.
It's blinking all right.
He's on.
Okay, so it is 12 o'clock, and I would like to get started,
Yeah, let's do it.
but we haven't done one of these for a month.
Well, yeah.
How come?
Because we were in Colorado last time. We were supposed to
What did we do in Colorado? I have
Oh,
what do I do with
we
my hands
taught-
now that
It's
you can
okay.
see
It's
my
okay.
hands?
put them in your lap like I did. Nope. Put them in your lap like I did.
I
You
don't know
did
what to do
not
with my-
have. You didn't have to learn where to put your hands
I
for
don't
an
know what to do
interview.
with my hands.
This is one being a review. We know it helps. Yeah, like that. That's perfect. Just,
Okay.
just you can.
What did we do in Colorado?
We were teaching doctors how to take out wisdom teeth
Yeah.
atraumatically, and we had a lot of fun. We were
Tons of
there
fun.
over your birthday.
That's
So
true. I had
that
a birthday
was-
since
that
we
was a
were
lot
on
of
one of these live events. That's true.
If you want to see some really adorable pictures and videos of Dr. Emmet walking around with birthday pins all over, look up Colorado Surgical Institute. They've got a ton of pictures and videos on their Instagram.
Yeah, it was pretty fun.
Yeah,
My favorite pin was they gave me one and it had, I'm not sacrilegious.
but
I'm
it
not-
had Jesus on it.
I'm not
and
trying to
it
pick a
was
fight
funny.
with religious people right now, but it has a picture of Jesus and it says, "See you soon,"
Yeah.
because I turned 46.
So I like the one that said "Kiss me, it's my birthday" or "Kiss me, I'm the birthday boy" or something.
Yeah,
And
something
we
like
had one patient that was like really loopy, and she was like, "He's so cute, I can't."
that.
And I was like, "Okay, he's married. Come
Okay,
on."
let's go next.
Car.
So yeah, we were in Colorado teaching surgery, had a birthday, been a lot of stuff going on, but we have a super fun topic today because we have lists of questions,
Yes.
where to put it, from patients about what the new 3-on-6 plus
Yes.
is. And so I decided that this week we would just talk about the 3-on-6 plus. And
We should probably introduce ourselves.
oh, hi guys. I'm
Wait a minute. I was like, we forgot something.
I'm Dr. Emett in Las Vegas, Nevada. This is,
I'm Tiffany, also from Las Vegas, Nevada.
you just said from Las Vegas, Nevada.
I live here now. Let's
She's,
just go.
she's not from here.
No, I'm from Utah, but I live in Las Vegas.
Yeah.
So,
Las Vegas.
but we're from All Out Dental in Las Vegas.
And at our office, we are a licensed 3-on-6 provider, and 3-on-6 is all we do. So
Exclusively 3-on-6.
in fact, a patient was in this chair, the exact one I was sitting in
Yeah,
actually, yesterday,
Mhm.
and said, "Okay, I just want 2 implants, crowns,
We need a bridge here and some veneers.
and some veneers, but I want to be asleep." And I was like, "I don't have time in my schedule to put you in. I only do 3-on-6. That's it." And I referred him to another provider here in Vegas who just texted me this morning.
I actually smiled because I was like, "Oh, we don't do
We don't
that."
do
And he was
that.
like, "Oh, really?" And I was like,
Yeah.
"Mm-mm. Nope."
So we are an office that just does 3-on-6 full mouth reconstruction. So if you know what 3-on-6 is, it's a full mouth reconstruction option where we give you 6 implants traditionally, because this is going to be a sticking point for today's conversation. Okay, so 3-on-6 is implants and bridges on top of those implants, right? That could sum it up. So anyway, did I introduce this enough? Is that good enough?
Yes.
Okay.
We've been thoroughly introduced now.
All right. And behind the camera is Bailey.
Who just nodded that we thoroughly
Yeah,
introduced.
he's going to keep us on schedule and on
Yes.
track today. So,
Normally Daisy's here, but Daisy had an appointment
oh, that's true.
because it was Daisy's birthday
Daisy's
yesterday.
birthday was yesterday.
She's so old now. She's out of her 20s.
30-30.
30 yesterday.
30.
So she had an appointment today to go.
This is kind of fun because if this is towards you, you can read Instagram comments.
Oh, I can't read that
I
far
can
away.
read it though.
But
Tiffany can
I
read
just
it. All right.
I just.
So, huge shout out. I know some of these names on here, but Jennifer
heck
Montgomery,
yeah.
we know who that is. Hi. Taking a short break from unpacking. Oh, well, that sounds like a lot of fun.
Yeah. Unpacking and cleaning. When you're done cleaning,
Just got here.
you
What
can
did I
go
miss?
to my house and stuff.
Start cleaning there.
Yeah.
Okay, so you just got here. What did you miss? You didn't miss anything because we've just been doing introductions and talking too much, but we're going to get going. So we're going to talk about the 3-on-6 and the 3-on-6 plus. Now, we use the term 3-on-6 to describe a whole lot of things that might fall in that category.
Yes. Yeah.
So when you see the term 3-on-6, you hear about a 3-on-6 provider, you might say, I have a 3-on-6. The core of what that traditionally means is you have 6 implants per arch. So 6 implants on top, 6 implants on bottom with 3 bridges. So 3 bridges on the top, 3 bridges on the bottom. That's where you get 3-on-6.
Yes.
You good there?
Yes.
And so what's happened is over the years, patients have received some variation of that treatment. I want you to know it's very common for patients to have, and we're just going to talk about one arch at a time. It's very common for patients to have one arch that might have 5 implants.
Mm-hmm.
They might have 6 implants. They might have 7 implants. They might even have 8 or 9 implants per arch.
There's a couple 8s and 9ers.
Yeah, we have some 8s and 9s. And so there was this.
Well, they also may have 1 bridge. They may have
Okay, thank you.
2 bridges.
So,
They may have 3 bridges. We have quite a few of our patients that have 6 implants,
yes,
2 bridges.
with 2 bridges. That's true. We do have that.
Or 5
Even
implants with
one bridge. That's definitely happened.
Yep.
So if you would have asked me previously, the hallmark difference, even after I was a dentist, but before I was really into full mouth,
Yes.
if you would have asked me what is an all-on-X versus a 3-on-6, I could not have answered it. In fact, I have a brother that's a dentist, and he literally looked at me one day. He's like, "What does that mean? I don't know what it means."
It actually comes up a lot when patients are like, "Oh, so you or not?" Doctors go, "Wait, so you do
What?
You do what?"
Yeah.
We're like, "Okay."
I'll be talking to dentists, and I'll say, "Yeah, I do FP1." And so you're also going to hear the term come up, FP1. And I have dentists, friends, people who've been in the profession a long time who don't know what an FP1 is. So these are terms that are very specific to full mouth reconstruction. And we're going to break these down today.
Yes.
So at the core, what the hallmark of a 3-on-6 is it is a FP1 treatment. And the thing that matters with FP1 is no fake gums.
Correct.
So when we talk about, actually, Bailey, we just hand me that little model.
No fake gums.
No, the one that's sitting on the computer right there.
No fake gums, but also that your teeth are contoured up into your gums.
Yeah.
There's not a flat interface with a flat interface.
And then hand me that model there. Yeah, the one in your hand. So this would be what I would consider an actually really nice looking
FP3.
FP.
You gotta put your hand on it.
Thanks. See how there's fake gums on there?
Daisy's watching this right now going, you
You
guys.
guys are dorks. Okay, see the fake
There you go.
gums? Now look at this. There's no fake gums. It's just the teeth up inside of your gums. This is an FP1.
You gotta show Insta.
Oh, here,
You
Insta.
You gotta show the grammars.
There's Instagram. So this is an FP1 right at my armpit. What am I doing? This is an FP1. And FP1 is where you don't have any fake gums. So at the hallmark, at the core of what a 3-on-6 is it's an FP1 treatment. It's where we don't go in and do gross bone removal. We do selective bone contouring to make your teeth look as natural as possible, to be as thin as possible. And that's what an FP1 is. And so in the world of FP1, we've already talked about that you can have different numbers of implants.
Mm-hmm.
So years ago, 3-on-6 came out and said, we have some patients who have enough bone that we're giving them more implants. We should call it something. So they started calling it a
4-on-8.
4-on-8. Now, if you're paying any attention here, it's already getting confusing.
Mm-hmm.
And I'm trying to do my very best to keep it not confusing. But the problem with the term 4-on-8, it sounds a lot like all on 4, right? Those two terms, just in general conversation, are confusing.
Yeah. And it's very, very often that a patient will come in and be like, yeah, I have. So I was looking at that all
4-on-1.
The 4-on-1. And I'm like, okay.
With just one big implant right
Yeah,
down your head,
yeah.
and it would just screw your teeth to one.
It's my favorite thing, and it's confusing. And if we weren't in this space, it would be even more confusing.
Yeah.
But for when a patient says, oh yeah, I looked at that all-on-1, and in my mind, every time I think of one implant holding on to a bridge going, I got this. And it just makes me smile every time. I'm like, yep.
So the hallmark thing that you're looking for with full mouth reconstruction is you want an FP1.
FP1.
You want an FP1.
FP1.
3-on-6 is a trademarked FP1.
Yes.
Let's just keep it super simple. And so what happened is just recently 3-on-6 got together. There's some super smart guys, by the way. They were all having a meeting somewhere and they said, look, 4-on-8 is too confusing.
Yes.
And it doesn't define what it is very good. So they said, what we're going to do is we're going to do away with the internal terminology of 4-on-8, and we're just going to call it the 3-on-6 plus.
Right.
So now, if you've been following along, 3-on-6 is an FP1. 3-on-6 plus is also an FP1. Now, what is the difference between a 3-on-6 and a 3-on-6 plus?
More implants.
More implants. The plus just stands for more implants. So it doesn't need to be any more confusing than that. You are still getting an FP1, which is what you want. You are just getting more implants. So before we called it a 4-on-8, but now we just have a different terminology to use, which is a 3-on-6 plus. So how many more implants, Tiffany?
Typically, it'd be 2 more on top, 2 more on bottom.
2
You'd
more on
have
top.
8 on top, 8 on bottom.
Now, why would somebody, so do some people need more implants?
Yeah. Some people do definitely.
So some patients may need to have a 3-on-6 plus. How come?
A lot of different factors. The patient that we talked to yesterday, he's young, very, very young. And
a little bit.
I need to talk louder. Dang it. I'm sorry. I'm fighting like allergies or something. And so I keep on like
Better than dragons.
trying to clear. I don't want to fight dragons. I'm fighting allergies, so my throat is like raspy. So I'm trying to talk so that I don't sound raspy. But okay, so our patient yesterday that we talked to, he is super, super young. But also how his existing bone is now, we wouldn't be able to get him very good chewing surface with a traditional 3-on-6.
Correct.
So by upgrading to a 3-on-6 plus, he's going to be able to maintain his chewing surface as he has now, which is a big deal, especially for a patient who that's what he's used to.
Yeah.
And he's young. He's younger than you.
Thanks.
And so that's a big thing for most of the patients that want 3-on-6 plus.
Yeah.
Is maintaining the chewing surface they currently have.
And so what I look at is a lot of what we're trying to do during 3-on-6 surgery is the most minimal amount of procedures to get to the best outcome.
Yes.
So specifically, we really try hard to avoid sinus lifts. Now we've done sinus lifts. I have patients that have sinus lifts. It's fine if that was what we have to do, but a lot of times we can avoid the maxillary sinus by placing an implant angled this way, but it limits how far back we can go. And this patient yesterday had a really wide maxillary sinus, really big. So even if I angle an implant back, it's going to come out just behind his canine.
Yeah.
It's not even going to come out into a molar spot. So now I've got to go behind that sinus and angle an implant this way. So they're going to kind of angle into each other. So this
Which will give
implant,
him actual molars to chew on instead of your premolars that are half the size of a molar. Not very helpful when it comes to chewing.
Yeah.
Can I pause really quick and push those buttons on your mic?
Apparently our mics aren't working.
They got like unpaired or something. The little like
What button? Link.
The little infinity sign?
Yeah.
I think mine's off.
Here. You better just take my mic.
Okay.
I'll just talk real loud for now. We're having some microphone. Actually, what I'm going to do while she's fixing our mics
Okay, I'm green again.
is I'm going to just go down some of these comments real quick. Hi, guys. Hi, how are you? Jennifer, laughy face. Hi.
That's because I asked Jennifer to clean my house.
Oh, that's right. Hey, guys, is it okay that my socket is still remaining after 17 days of my extraction? Food sometimes goes in there. I'm not experiencing pain, though. That's not a related question to 3-on-6 or full mouth reconstruction, most likely. I don't want to say it's good or bad. That's just a great conversation for your treating doctor. Sometimes our sockets do remain open for a little bit longer, but there's usually some things we can do to prevent that from happening, like socket preservation, bone grafting,
Depends on which tooth.
sutures. It all depends on which tooth. So that's not something I would feel real comfortable just answering without being the guy or team that actually did your work. So love you,
since I
Tiff.
don't think that's our patient from Wednesday.
Yeah, since you're not my patient that I just did surgery on. Okay. Hi, Instagram. I'm not forgetting about you guys up there. Anyway, is there any questions on
You're
everybody?
like our little
Maybe
guardian
answer?
angel that's just like sitting up there.
DJ said, I just want my confidence back. I've become
Heck yeah.
sad and depressed these past couple
Oh, heck no. Call the office.
Call the office. That's
What
Get you
number
in here.
should he call?
702-710-9006.
good job.
I have to say the phone number because Dr. Emmett buzzes through it sometimes.
I say too quick. Okay. So picking back up on 3 on 6. What
3 on 6 plus.
I know, but what was I saying about it? Right?
Talking about restoring their normal chewing surface.
So do some people need it? The answer is yes.
Yes.
Now,
Absolutely.
if I would have told this patient about this 3 months ago, I'd have called it a 4 on 8.
Or
but-
even 6 weeks ago.
Yeah, 6 weeks ago.
Yeah.
So the end result would have been the same, just different terminology.
Yes.
But this patient needs it. In order to get their smile restored properly, they need to have the added tooth back there, the added implant, and some more chewing surface. Do some patients not need it, but just want it?
Oh yeah, absolutely.
So
we've had
you
quite
can
a few of
just
those. Yeah.
want more chewing surface.
We have a patient who was like, I need those teeth. And it's so funny because his biggest complaint the whole time was like, my teeth are just really far back there.
Teeth so
We're
far
like,
back.
yeah, bro, that's what he wanted.
Yeah.
But you were able to adjust his bridges a little bit and make it feel like
Yeah.
back to what is normal for him. But it was really funny. He's like, yeah, I got so much teeth. And I'm like, that's what you
wanted.
asked for.
So generally, and for a long time, and this is very true, most patients, and I really mean this, most patients don't need the 3 on 6 plus. They haven't needed the 3 on 6 plus.
Right. Right.
They're going to get completely adequate chewing surface,
Yes.
really good, strong stability, good foundation without needing the 3 on 6 plus.
Yes.
Now, it gained some attention lately because it popped up on the Facebook group
With the announcement of
with the announcement of the name change. We're like, oh my
Yes,
gosh,
yeah.
what did I not get? What should I be getting? And so just to clear up any general confusion about that, as your providers, you want my microphone
Yes,
too?
She's
please.
gonna put it back in the
I'm
box.
gonna
and make 'em
repair
all-
them.
make
Sorry.
'em all repair.
And then we've got to turn the heater off.
Yeah.
Yes,
I
I
just
will.
look over at him and I'm like, this part that starts to
They turned the
sweat
heater
first.
on and it got so hot in
it's
here.
getting-
To be fair, our heater wasn't working yesterday. So if you were a patient that was here yesterday and it was
Freezing cold.
64 degrees, sorry, it was actually 64 degrees, like really light. So
Okay, so We're gonna just talk
really loud.
so if you look at this picture, you can see 3 on 6 versus 3 on 6 plus. 6 implants per arch, 8 implants per arch. But what's most important about this is on the 8 one, you can see, Tiffany, if you go point to this and point, because I'm looking underneath of it, point where they added a molar.
Oh, added the molar up here.
Yep. See how on the 3 on 6 plus, there's one more molar.
Well,
Instagram, can you see this?
Interestingly enough, here, hold that back down. They didn't add a molar. They added a premolar technically. So
Yeah.
this little guy right here, premolar. This little guy right here, premolar. So you get that much extra chewing surface. Now, for patients who that's a big deal for, that's a big deal for. It on a piece of paper, even on a bridge, when we hold a bridge in our hand and it has 2 premolars, it doesn't look that
It doesn't
significant.
look that much.
But for a patient who that's what their expectation is,
Yeah.
when they're like, we've had patients who are like, yeah, I don't have enough chewing surface.
I just need
And-
more to chew on.
Yep.
But in my case, from my perspective, I'm going to give you the same treatment today that I would have 6 months ago,
Yeah,
that I would have
absolutely.
a year ago, that I would have 2 years ago.
Absolutely.
My goal is to give you the very
Mhm.
best outcome, which is the strongest foundation with the most chewing surface that's practical.
That you can rely on.
Right. So people are asking, can I upgrade if I have a 3 on 6, should I go get a 3 on 6 plus? What's the answer? Just say it.
No.
No.
I
Because
was like, no.
the implants are planned in a much
Very
different orientation.
spots. Yeah, very different spots.
So if you've been getting along great with your 3-on-6, you're not missing something.
No, absolutely.
This is not like you didn't upgrade to the biggie meal and you didn't get something in the beginning. All right, is that better, Bae?
Yeah.
All right. So you still have all the stuff that you need to have a successful outcome with your 3-on-6. You don't have to have a 3-on-6 plus.
Correct.
So I'm going to read you something that is from the website. Where did I highlight it at?
Where did you highlight it in?
Thank
If
you.
you highlighted it in yellow, can't see.
Okay, this is an important statement, and I want you to hear this. The plus version isn't about quality, it's about capacity. If your anatomy allows for more hardware, 3-on-6 plus provides greater structural support. That's true. You have more implants, but it's if your anatomy allows for it.
Right.
Even patients who come in saying, I want another tooth to chew on, they may not have the bone to put it in. In the top, on the maxilla, the top arch, that's our biggest issue because one, the bone up here is soft. It's way softer than the bone on the bottom. So we're always trying to maximize the distance from our implants, how far apart they are. And we're talking about measuring these things in millimeters and fractions of millimeters. How much distance are in between them? How far back do they go? And so often a patient will say, well, I kind of wanted one a little bit further back, but there's literally no bone there, or the bone that's there is like as thin as eggshell. It's really, really thin bone. Yeah. So there's not enough room to put an implant without undergoing sinus lifts and like other procedures. Yeah. So,
or more complex implants.
Yeah, two staged procedures.
Right.
So is it possible that a patient could want a 3-on-6 plus and they're not a candidate for it? Yes. Yeah. So even if you came into your office and said, I'm here for the 3-on-6 plus, they may go, you just don't have enough bone. Yeah. But don't take that as a negative. You are still going to be a candidate for a 3-on-6, which is still far superior to any other option out there. But now the terminology is not as confusing with all on X or all on 4.
I think for a lot of patients, for example, our patient from this Wednesday, if you had given her a 3-on-6 plus, she did not have back molars for years. Years.
We gave her teeth.
If you had
even on Wednesday, she went, it's so weird. I have teeth in my mouth.
Yeah, it would be so much to get used to.
That's true.
It'd be a mind shift for sure. So yeah, and she had bone far enough back to have molars and all. I mean, she has a
whole mouth full of teeth.
3-on-6. It's, and even then, even during when she was waking up, she was like, her tongue was just doing a little exploration. She's like, I have so many teeth. So I can't imagine if you had given her more teeth. Her tongue would have to get used to getting out of the way a lot.
She came in yesterday and said, I just feel like I have so many teeth because she hasn't had teeth for a long time. Bailey, what's going on?
We got an Instagram question.
Okay.
They said, how can you tell if someone needs more chew space?
How can you tell if someone needs more chew space? Need is a relative term, but there's a lot of things we look at. We look at your freeway space, the space between your teeth when you talk. We look at your buccal corridors, which is when you smile. How much space do we see? And we also look at what you have existing in your mouth and what you're used to. And also just the size of your mouth. If we've got some big 7-foot tall, huge guy in my chair, he may be used to a big mouth and need a lot of chewing surface compared to my 120-pound, my 120-pound, like 70-year-old female patient with a small mouth. We've talked about vastly different amounts of chewing surface. Yeah. So my goal for everybody, I'd say it all the time, I want them to have at least one molar. Yeah. I want you to have a good molar that's really well supported that you can chew on.
Well, literature says at first molar does most of your chewing anyway.
Yeah, that's true.
Most of your chewing happens on your first molar or your 6-year-old molars, whatever you want to call them. And I tell you all the time, take out my seconds. I don't use them. They're too far back in my mouth. I don't use them. So
Okay, so I'm going to read one more sentence, then Bailey's holding up a sign for me. That means I need to do something.
Handwriting is so cute.
All right. So
I love it.
I'm going to read this sentence. The 3-on-6 remains the gold standard for full mouth restoration.
Absolutely.
That's right from the website.
Yeah.
This isn't as per Jason Emett. This is the 3-on-6 remains the gold standard for full mouth restoration. So even though there is this other option, there may exist a possibility to get an extra 2 implants. You don't have to have them most of the time.
Right.
All right. So Bailey just held up a sign because we have people asking how to find us. And I do a bad job of plugging and promoting us.
Yourself?
And myself. But basically, if you like what you're seeing here, you should follow us on all of our platforms because we have, I don't know how many videos. How many videos on YouTube?
Oh, so many.
Can we say it's 100?
Yeah.
We have well over 100 videos explaining concepts, recovery, about surgery, all that stuff. So you want to go find us on Instagram, Facebook, YouTube, and Reddit.
And now Reddit.
And yeah, now we're on Reddit. So our handle is just at All Out Dental. Just like it sounds, All Out Dental.
Well, we go all out for you.
Yeah, thanks. That's
Also, guess who joined the live? Poi.
What's
Poi.
up, Poi?
Oh, Poi.
Poi does our editing.
What's up, Poi?
Poi edits our videos.
That's cool. What's up, Poi?
So when you see our videos,
Shout
I'm
out to
like,
Poi.
those
He
are
does a great job.
awesome. Poi's
Jake said, do you consider Dr. Locke to be the most handsome 3-on-6
Oh,
provider?
please. Man.
So
Okay, I know who Jake is. And
Yep.
Jake, Dr. Emett and Dr. Locke have a bromance that will never.
there is no doubt that Dr. Locke is the most handsome.
They
3-on-6
run
provider.
to each other. They jump into each other's arms. When we're training at 3-on-6, Dr. Emett dresses just like Dr.
I
Locke.
do not. And we're going to be in Mexico with him in 2 months.
Yeah. Dr. Emmett was like, I should grow my hair out like Dr. Locke. So I was like, no, we love
Yeah,
Dr.
he's
Locke.
for sure the most handsomest. He's my mentor. He's who trained me how to do 3-on-6.
Yes.
So yeah, a lot of respect for Dr. Locke.
We love Dr. Locke.
Another thing, I didn't bring this up at the beginning, but we didn't talk about my new sign that I got for my birthday.
Oh, check this out.
Keep your gums with Dr. Emmett. This is my favorite thing I may have ever received for my birthday. It's so fun.
Ever received for your
received.
birthday? I love that. Yeah, it changes
Yeah,
colors.
where's the remote? Well, we don't need to do it. You want to do it?
Go
Okay.
for it.
So, it
So we
changes
tried to
colors.
find one where it would show up, but it
It's
changes
really, yeah, I was
colors.
saying, it changes
It
colors.
does all kinds
It
of cool
blinks.
stuff.
I'm not gonna make it blink because it's like we have to have like a warning that it's like seizure induced.
Yeah, we don't want to give people
But
seizures.
Is it back to pink?
Close
Kind
enough.
of
Pretty
purpley?
close.
Pretty close.
Okay.
Okay,
Super
so
fun. Super
that's how to
fun.
find us if you want to ask questions or you want to get scheduled for a consultation. Our guy who's watching on Instagram right now, the best thing is just to come into the office and have a live consultation. And no matter where you are on your 3-on-6 journey, maybe you've had your surgery already, maybe you're considering it. I always tell people, go see your nearest 3-on-6 provider and have the conversation because everybody's situation is a little bit unique.
Mhm.
And 3-on-6 Plus only highlights that more.
Yes.
So if you come in the door with an open mind saying, I'm here to get the best thing possible, you're in the right spot already because you're getting a 3-on-6.
Yes. And I will say we also do virtual consultations.
Oh yeah, a lot of
For
virtual.
patients who are not in Las Vegas, which are a lot of our patients.
Over half our
Um,
patients
Yeah, I think we're
Which I knew
pushing.
the
I think we're pushing 70% of our patients are from out of state.
fly into see us
But
from somewhere
yes,
else.
we start
Hawaii.
you off.
So
got
many
lots of
Hawaii
Hawaii.
right now.
But we would start you off with a virtual consultation where we answered all your questions. There's not a fee for it. There's no obligation. We're not car salesmen, and we're not going to be. There's a Valentine's Day special if you sign up today.
We had somebody ask us that a year
I
ago.
know, and I was like,
Is there a Valentine's Day deal?
no, sorry.
Not a Valentine's Day. Okay.
But there is a President's Day sale. No, I'm just kidding.
Okay, so any other questions on Insta that we need to get to? We're doing good.
Nope.
Doing good.
Jake just replied with a laughy face.
Okay.
Yes, yeah.
Yeah.
Mhm.
All right. So, questions. I'm just going to go down now. We've taken a bunch of questions that were submitted
Mhm.
about 3-on-6, and we're just going to go down and start answering them.
Okay.
All right. So, why would someone need 3-on-6 Plus?
We answered that.
We kind of answered that.
Yeah.
Do we need to go over it more?
You-
What does 3-on-6 Plus do? I stole another sentence from here, and I want to.
Dr. Emett does way more research for these than I do.
Huh.
I just show up.
Let's see.
He had a whole marketing meeting this morning.
That's
like,
true. I've been doing a lot.
I
So we
just
got
showed
here.
up. I have no idea.
Yeah, well, I'm not doing a very
We
good job
kind of
finding it.
went over why would someone need a 3-on-6 plus.
Just
don't
for the
have-
people who have recently joined, just go over what 3-on-6 plus is one more time.
Okay, so 3-on-6 plus is 2 more implants per arch. That's what the plus means.
2 more implants on top. 2 more
And it's
implants on
replacing the terminology from 4-on-8 to
3-on-6
3-on-6 plus, just to keep it uniform and easy to talk about without it being so confusing.
Yes.
The investment. In my mind, I've got to talk about it. Is there a price difference between the 3-on-6 and a 3-on-6 plus?
Yes.
Yes. Is it less than bilateral sinus lifts? Yes.
Absolutely.
But is there still financial investment?
Yes.
Yes. In our office, Tiffany, how much is it to have a 3-on-6 plus per arch?
You're not gonna like my answer.
Listen, I don't try to not talk about money in front of our followers, our faithful few.
We charge 30,000 per arch for a 3-on-6 plus before any discount.
That's correct.
Yes.
So it's 5,000 more per arch, essentially.
Yes.
Just plan on that because that's what I'm seeing across the board.
Yes.
Is there always some variation between offices? Yes, there can be some slight variation, but that's what offices are charging. So if you went in and you wanted to have a full mouth 3-on-6 versus a 3-on-6 plus, I think it's reasonable to expect that you're going to spend about $10,000 more for a 3-on-6 plus.
5 to 10,000
versus-
depending on
Sure.
office and things like that.
So
Because it's not going to be that way across the board.
I know, and I don't want another provider to be like, "Whoa,
Each-
why'd you
each office
say it was only X amount of
charges
dollars?"
Each office charges their own fee.
Because
for
somebody's
all out
market and
dental-
their region, they might charge
Yes.
12,000 more.
Yes.
But yes, there's an added cost, and in my office, it's $5,000 per arch.
Yes.
We have an Instagram question.
Okay.
Is there anything that would exclude someone from getting the 3-on-6?
Absolutely.
Oh, from a 3-on-6.
Mhm.
Yeah.
Yes.
How many times, honestly? Okay, so the question is there anything that would exclude somebody from getting a 3-on-6?
Yes.
How many times, just honestly, has somebody been in our office to see if they're a candidate, and I told them no, they're not a candidate for 3-on-6?
Twice.
Twice.
Well, other that they're truly not a candidate, not that they don't need the treatment. We did have a patient that she was
They needed some
adamant.
veneers.
She was adamant that she wanted this because she didn't want to go through braces.
Right.
And you told her you were not taking out her
I'm not
perfectly
taking all
healthy
your
teeth
perfectly healthy
so that
teeth.
you don't have to do braces.
So don't count her.
Yeah,
Uh,
so 2. There was
two
2
people.
that are truly, they were not a candidate due to bone levels. They did not have the bone for a 3-on-6.
For a 3-on-6.
Yes.
Now they could still have something else done. They could
Yes.
still be a candidate potentially for an all-on-X
Yes, which they were still a candidate for an all-on-X
with zygomatic implants.
zygomatic implants. Yes, correct.
So I can tell you that most of the time, way over 95% of the time,
Yes.
patients who are a candidate for an all-on-X are also a candidate for 3-on-6.
And my favorite is when a patient has been told,
Oh,
oh, you don't have enough bone for an all-on-X. And then they come in and I'm like,
and they leave.
great, because you're a candidate for this.
We've had many patients
So many
in the
patients.
chair
Yeah.
to get an all-on-X and have the doctor come in and say, I just don't think I can do your
You're
case.
not a candidate for this.
One lady had flown in from North Carolina
Yes. Yeah.
to Las Vegas and came to see us the next day. I said, yeah, you're a candidate. She flew back 2 weeks later and she
Had
has a
surgery.
beautiful 3-on-6
Yeah,
and
she's got a
she's
gorgeous 3-on-6.
rocking it and it's amazing. So there can be things that prevent you from being a candidate. One would be if something in your health history prevents it.
Yes,
So if there's
absolutely.
something in your health history that prevents you from having implants or something, sure. But it's going to come down to bone levels, and it's uncommon that you would not be a candidate. And I spoke directly at the camera to the Instagram
To the
attendees.
She just asked another question.
Okay.
That's it. You only get 2 questions. So you've got to knock it off.
Then we start charging.
All right, what is it?
Any complications with patients that have autoimmune issues?
There can
It
be.
can be. Yeah.
So the person asked, can there be complications with autoimmune diseases? And the answer is, yeah, it depends on which autoimmune disease, which I don't encourage you to share on this public forum right now. But what I would encourage you to do is contact my office and schedule a personal consultation. I will talk to you about your specific autoimmune disease, specifically the symptoms you're having. And we have a lot of patients with autoimmune
I was gonna
disease.
say we have tons of patients that have autoimmune diseases that are in
finals
great,
and have
amazing,
beautiful
3 on 6.
teeth. It totally is doable.
I'm like sitting here thinking, I was like,
Don't say their
like
names.
his is great, hers is wonderful. Yeah.
But yeah, there can be, but we definitely take that in consideration. Okay, that's funny. The next question was, what is the price range for the 3 on 6 plus? We handled that. Can people eat apples with the 3 on 6 plus?
Yeah, just like you can with the 3 on 6.
Same thing.
In your finals.
Ooh, I'm not going to pick on anybody right now.
We're not going to pick on anybody right
you
this
know who
very
you are.
second, but you know
If you're
who
watching
you are.
this because you came to my office this week and you weren't following your soft food diet, I still like you. I still
We
do.
still love you as a patient, but
But
McDonald's
Yeah, you got to follow the
breakfast
soft food diet.
sandwiches are not on your.
So yeah,
list.
you can eat apples with your finals.
Yes, absolutely.
Is the 3 on 6 plus made from different material?
No.
Nope, identical.
Same materials, same titanium implants, same zirconia teeth,
Same zirconia teeth.
same resin temporaries.
About 10 minutes ago, I asked Bailey to go turn the heater off
And now it's
because I was dying. I literally was so hot.
I'm trying so
And
hard.
now
not
the
to
air
sniff
conditioner went
camera.
on and it's blowing cold air down my neck and I'm freezing. It's off though. I just heard it stop. It just stopped blowing. So it knows that we're turning to Eskimos in here.
It must have got down to 59 degrees.
Yeah. Is the warranty for a 4 on 8 different than a 3 on 6?
3 on 6.
Oh, sorry. Chase,
See.
Dr. Emett. Oh, is the warranty for, well, I'm just reading it. That's
The
my fault.
warranty.
Because it says 4 on 8, but it
yes,
needed to say 3 on 6 plus.
The warranty is identical.
It's the exact same.
Exact same.
Okay.
Keep in mind, you still. Sorry. See, allergies. That's why I wasn't
Puberty?
talking. Not for a while. No, but keep in mind, because I had this question in a consultation this week. The warranty for 3 on 6 or 3 on 6 plus, it is not a free pass. You still have to hold up your end of things. You still have to go to your cleanings.
Yes.
You still cannot smoke.
Yes.
Good for you if you quit during healing. Awesome. You still have to not smoke.
Yes.
It voids your warranty. What she asked me specifically about, I'll have to think about it, but your warranty is not, it's just like your car. If you have an extended warranty on your car and you drive it into a telephone pole, they are not going to give you a new car.
Right. Or if you don't get the oil changed,
Yes.
they're not going to just be like, oh, don't worry about it.
Oh, all right.
We'll just put a new
That's-
engine there. You didn't take care of your last one. So yeah, so you got to come to your cleanings.
Still have to do your part.
We had a question. Charles just asked, can this be done with local?
Like local anesthetic.
I'm sure that's what he means.
We always give you local anesthetic.
You're just asleep.
You're just asleep.
Okay, though, and from a very, very real answer to your question, and we have whole videos about this. We did a whole segment on this. In my office, I do not do a 3 on 6 treatment without sedation.
Yes.
Period. The length of time that procedure becomes, the challenging aspects of having a patient awake for this, all the extractions, all of the work that it takes to get it done, it is not pleasant.
Mm-hmm.
It's so nice to pop in the office, go to sleep, have the surgery done, and wake up and go home and not know what happened.
Yes.
There's so many huge advantages for everybody, primarily a secured airway, not a protected airway, a secured airway.
Yes.
Your airway is completely protected and secured. We have the ability to make sure that your lung capacity and all of your breathing is good, and it keeps it free from debris. So if you have a tube up your nose and down your throat and you're intubated, we don't have anything that can go down your throat, down into your lungs. So it's a safer way for most patients to undergo this procedure.
Now, I would say, Charles, if there's a medical reason you cannot be sedated, talk to your nearest 3 on 6 provider. But as far as our office,
If you can't safely be sedated and you're medically complex for that reason, there's typically other stuff going on that you may not be a candidate for implants anyway.
Yes. Yep.
But that's a conversation unique to every person. Now, I do know of an office that has attempted some 3 on 6 with under local only, and I don't think they'll ever do it again.
Yes.
So
And they only did one arch at a time.
One arch at a time. So this drags it out for days.
So the patient came back to back days. I think the patient's been on the Facebook before and said that she wishes she had
Just did it the other
just
way.
done, yeah.
Yeah.
And hers wasn't medical. It was more just her comfort. She was so scared to go to sleep. So yeah,
Yeah.
She wishes she'd gone to sleep.
So I just saw a name that I recognized, but somebody named Tony just asked, I just joined. Can you say what the plus is for us that just were able to join? Otherwise, I will contact you next week. Tony, 3-on-6 plus is just the new terminology for what used to be called the 4-on-8. And it is simple terms, one extra implant on top of each side and one extra implant on bottom on each side. So if you did just a 4-on-6, Jason, stop. If you did just a 3-on-6 plus on top, you would have
8 implants.
8 implants,
on top,
one extra
8
implant.
implants on bottom.
Yeah.
See why we changed the terminology to 3-on-6?
Even us that talk about it all day long, it's confusing.
This is all he does.
I want to show you another picture, Tony. Maybe you can see this if I get it in the right spot.
Right there.
So it's
Show the grammars.
just that. It's just more implants, 2 more implants, and then your bridges are segmented into 4 pieces instead of 3. Now, if your surgery has already been done, you hold it right there, then you'll see that. If your surgery is already completed, then you don't need to have this done. And we've talked earlier about, can you convert from a 3-on-6 to a 4-on-8? The truth is it's unlikely because your implants were placed in the ideal position to support a 3-on-6 and not a 3-on-6 plus.
Correct.
So, yeah, but I'd love to talk to you next week if you have a specific question. Okay, back to our question list.
I think we'll be talking before 2 o'clock.
I hope so.
I'm like doing backwards math in my head, but I think we'll be seeing you.
What do you mean you have enough bone for the plus? We've talked about that, but traditionally we would utilize a special piece of bone in the back of the mouth. What's it called, Tiffany?
Pterygoid.
A pterygoid implant into the pterygoid.
By the way, it's spelled with a P.
Pterygoid.
Like pterodactyl.
Yeah. So we can either put if there's enough room in the tuberosity, sometimes we can use the tuberosity type implant, or we angle backwards a little bit and hook into the pterygoid implant.
Tuberosity is just another piece of bone in your mouth. Just really far back there.
So, yeah. Can a person get a regular 3-on-6 if they don't qualify for the plus? Yeah.
That's what they would get.
Yeah, you'd have a 3-on-6. If you do a plus on the top, do you have to do it on the bottom?
Not always.
Not always.
I'd say not always.
I would say definitely not always.
I think
because the place
because a lot of our patients who have a 3-on-6 plus on top
don't have it on bottom.
Not have it on bottom.
Because on the top we have this extra piece of bone we can go into, but on the bottom we just run out of space.
Yeah.
So I would say that a 3-on-6 plus on the top is a lot more common than a 3-on-6 plus on the bottom.
I'm thinking we have 3.
Watch, Dr. Roberts is going to be watching this right now and be like, "Oh, that's so wrong," or something.
We have 3 that match top and bottom.
Yeah. So you can totally do one versus the other. But I think from a proactive standpoint and treatment planning, I would like you to have teeth across from each other. So if I'm going to give you a plus on the top, I'd like to give you a plus on the bottom.
Yes.
And we might have to get creative on how we're spacing out these implants. But if I'm going into it from a pure perspective of trying to get you into a plus on the bottom, I would definitely space my implants differently to support that versus the top. So I'll still with what you already did. It was amazing. Looking forward to coming back in April. See you in April, Tony. All right. Let's see. Can you turn? We already talked about that. Is the 3-on-6 plus still a guided surgery?
Yes,
Yep.
absolutely.
Still guided.
Oh yeah.
We still want to make sure we get everything in the right place exactly as we had it planned to do. So again, guys, this is a live call. So right now, if you have any questions,
Live call. Live video.
live video, live what?
Live call.
Event? This is live. It's happening right now on February 20th, Friday at 12:43. I can
Call
prove
in
it.
and pledge today.
Pledge today.
That's what it sounded like we're PBS.
So, well, I'm telling them, ask your question.
Yeah.
Because if you're sitting there watching this and you have any question whatsoever about 3-on-6, about 3-on-6 plus, about the surgery, just ask it because we'll answer it. We have a whole bunch of other questions we're going to transition to right now that aren't even related to 3-on-6 plus. They're just more questions. And so if you're on the call and you have a 3-on-6 plus question, I definitely want to answer that for you, but I definitely am going to switch over and start answering more questions. But before I do that, if somebody wants to get scheduled for a free consultation,
Yes.
how do they do that, Tiffany?
They call 702-710-9006. And you'll talk to Daisy or Amelia, and they will get you scheduled for a virtual consultation, an in-person consultation. Though, if they don't have the answer to your question, we've probably never been asked it before. They are extremely knowledgeable. This is all we do in our office. So they will definitely be able to answer the questions.
You know how bad it is when the girl behind the camera keeps looking at me and going this
She hasn't had to tell me.
and tell me to put my shirt down.
I'm smiling and sitting up straight.
I get RBF. I get RBF and I get real comfortable. Okay. So they could also go to
alloutdental.com.
Good job. You got it.
All out.
You're my mind.
And now that you've been on our live, you'll start getting our ads.
Yeah. So
Because I do for 2 weeks.
any questions on Instagram on that one that we haven't answered yet? Okay,
Sweet.
we're going to start going over some other questions right now since we
Yes.
don't have any others. So one question that keeps popping up a lot,
I had this
and
question a lot during consultations
Yeah,
recently.
is
the hygiene
we're going to talk about
questions.
hygiene and what it takes to maintain these things. So how
Yes.
often, let's start at the basic. How often do you brush your teeth with a 3-on-6?
Morning and night, at least.
Minimum.
Morning and night.
Minimum 2 times a day.
Yes.
How often do you use your water pick?
Twice a day, at least.
Minimum.
Morning and night.
How often do you use regular floss? You don't have to floss these.
Yes.
If you have some food stuck between your 2 bridges, your 3 bridges, floss it. I'm not saying you can't use floss, but
have
you
to.
don't need to floss anymore. I want your tissue to attach to the bridges.
Yes.
So every time you try to floss in between your bridges and underneath your bridges,
You're
you're
breaking that contact.
breaking the soft tissue
Yes.
attachment.
Yeah. Don't do that.
So by design, some patients have their pontic or their bridge up from their tissue a little bit.
Mhm.
And if that's the case, we'll tell you this is an area that you need to floss.
Mhm.
But also when it comes to your hygiene appointment, coming in and seeing the hygienist
Yes.
or the dentist, whoever's cleaning your teeth, your 6-month appointments,
Mhm.
do you floss underneath these bridges? No. The number one thing I tell offices, so for example, we talk about this, a lot of our patients fly in to see us from across the country.
Yes.
And when
You almost said world.
I know, but it hasn't happened yet.
But we have a patient that is talking to us from
The
Canada.
problem is I know that Hawaii is still in our country. I know we have
Yes.
we have a patient that's looking at coming in from another country, and
Yes.
we'll see how that goes.
Canada.
But let's just say country. They don't have to come back to see me to get their teeth cleaned. Now, a guy
So
drove
many of our patients do.
16 hours
Yes.
a few weeks ago to get his teeth cleaned.
Yes.
And he's like, nope, you're my dentist. This is where I get it done.
Yes.
I'm honored by that. I think it's beautiful, but you don't have to. So the number one thing I am telling these
All of our
offices,
patients are like, I'm still coming to see you.
well, one lady flies here from North Carolina.
Yeah.
Okay, but you don't have to. If you want to go get your teeth cleaned, have your office call me, local, just find the one that's right down the street. And the number one thing-
we have a video.
Yeah, the number one thing I'm telling this hygienist or this office is going to clean their teeth is don't floss under the bridge
Don't take the bridges off.
and don't take the bridges off.
Leave the bridges in.
And they're like, oh, well, that's not what we do with all on X. And I say, I know,
That's
this
what
is not all on
is.
X. We don't take the bridges off. We don't floss underneath the bridges. Stop making it more difficult than just
Yes.
treating them like normal teeth.
And we had a patient on a virtual consultation the other day, and she said, "Would I know if they were taking my bridges out?" And I said, "You would know."
You would know.
I said, "They're going to be drilling out the little fillings that we put in."
Right. It's a lot
You
of
would
work.
know. So
You don't need to take them out.
don't take them out.
They're serviceable, but you don't have to service them every cleaning.
Yes.
Okay. How long are the appointments for when I come in to get my teeth cleaned?
Ours are quick. They're like 45 minutes to an hour. They're
45
quick.
minutes.
That's an x-ray. That's your cleaning. That's your exam. They're 45 minutes to an hour.
It's fast.
We got an Instagram comment
Oh, Instagram comment.
that says, I'm glad I started using my water pick awaiting surgery. That thing needs training and practice.
Yes.
The first couple
Yeah.
weeks you use your water pick, you might make a mess on your mirror,
Yes. Oh, yeah.
all over the bathroom. That's normal. Don't feel bad.
I've used one for years, and I'm like, oh, okay, that it's everywhere.
It's a lot.
Yeah.
But you'll get better at it. I promise.
You're gonna
Comes
kind of get
easier.
addicted to it. I promise. Every single one of
Yeah.
our patients, they're like, I use
I use
it
it
every
3
time
times a day. I use it all day at work. Yeah.
Great. Wonderful.
Cool.
You can't use it too much.
Nope, you can use as much as you want.
Yep.
Okay. Do I need an X-ray every time I come in for my maintenance?
Yes.
Yeah.
We take a panoramic x-ray every time you come in. For
Why
your
do I just take a panoramic x-ray?
So we can check the bone levels around your cute little implant.
It's so easy. You stand in the machine, it goes around your head one time, you're not having that thing stuck in your mouth and trying to bite on it. And all I'm looking for is the bone height around the implant.
Yep.
I'm just making sure that everything is looking the same as it did at your last appointment. And if something looks different, are we seeing some bone changes? Are we seeing a change? Let's address it now before it becomes a big problem in the future.
And there's other x-rays we may
I might
at
take
that
another
point,
x-ray, but
but
rarely.
I'm trying to think of the last time I had to take one. Once.
Long
maybe.
time.
Yeah, once maybe I had to take the other x-ray.
All right. How much does a cleaning cost?
At our office, they're $150 per
They're
visit.
$149. Give them that dollar back.
Daisy changed it.
Did she change it to 150? Okay, but
Yes.
I keep hearing that that's really low.
Yes. Yeah.
So-
at our office, it's $300 a year to maintain.
Yeah.
So,
If your office is charging $250, whatever, it's a few $100s every 6 months to have your $50,000 investment maintained.
yes.
That's a pretty good deal.
Yeah. You're going to spend less maintaining your 3-on-6 or 3-on-6 plus than you will paying premiums to a dental insurance company.
Nice. That was really well said.
Yeah,
I like
to a
that.
coupon company.
There you go. Good job.
I'm gonna get sued by Delta Dental one day. I just know it.
I hope they call us. I got some.
I hope they
I got some
call.
stuff to say to them.
Me too.
All right. We have exactly 10 minutes left.
Sweet.
So, can any office do the cleanings?
Yes.
Any modern office?
Any modern
That's
dental
why we both want to
office.
say modern.
Yes, modern dental office can do your.
I don't want to say
cleanings.
every office can, but any modern dental office can do
Yes.
it. Can my final zirconia bridges stain?
No.
They can't. So what happens
Zirconia
if I
does
look
not
at my
stain.
final bridges and it's been 5 months since my cleaning and I see some staining or I see some stuff on my bridges?
The teeth are not staining. The biofilm that may be stuck to them.
You're trained so
Staining.
good.
I'm trained so good.
Oh my gosh, you've been training me so good.
That's
So at your cleaning, we also polish your teeth.
yes.
So we clean off all of the biofilm and we
Yes.
clean off what you are perceiving as stain.
Biofilm's a fancy word for plaque, by the way. Plaque and buildup.
Perfect.
Yeah.
Can a screw channel be refilled at one of my cleanings?
Yeah. Oh, absolutely.
Sure.
We prefer to do it then
It's
because,
fast,
well, for so many reasons. First of all, you're already here.
right?
You're not going to have to leave work or come take.
We'll
more
literally
time
walk
off
in the
schedule.
room with the
Oh, it
stuff and
takes
just
like
sit
2
down and just fill it
seconds.
in
Yeah.
a matter of
Takes
minutes
like
and
2
send you out the
seconds.
door.
Yeah,
So
that's a
easy,
quick
easy
thing.
peasy. Okay, so that was not all the questions, but we've gone through a lot of the questions. But this whole thing was supposed to be dedicated to 3-on-6 plus.
Yeah.
We have 10 minutes left.
Yes.
So if you have a question about 3-on-6 plus, now's your time to ask it. I will answer your question or do my best at answering it. So just to recap, what is a 3-on-6 plus?
You have 8 implants on top and 8 implants on bottom.
So there's a picture.
It's just-
there.
Remember, it's the number of implants, not the number of bridges.
Correct. And remember that both of these are also an FP1. They're both 3-on-6. Okay, so that's what a 3-on-6 plus is. Does the 3-on-6 plus cost more?
Yes.
Okay. Does every patient have to have a 3-on-6 plus?
Absolutely not.
Is it like buying a used car when you come in and we're going to try to sell you a 3-on-6 plus?
Yeah, if you don't sign up for
need it?
today, if you don't sign up today, then it's gone tomorrow. No.
So we're not trying to sell you into a 3-on-6 plus. We've just used more uniform terminology to describe when somebody gets more implants per arch.
Even the patient that you spoke to yesterday about 3-on-6 plus.
Yes.
Dr. Emett is extremely conservative with his treatment planning. He was like talking himself in and out of it in circles, which
I'm
makes me
sorry.
smile because he's my best friend, so I know what he's doing. And finally he goes, "You can do it either way, man. If you just want this much, I really feel like this is the better way to go." And the patient was like, "Oh yeah, no, that's what I want." And he's like, "Okay." And I'm like,
Yeah.
I knew what you were doing. You're like, I don't want him to feel like I'm trying to sell him something.
I
I
want to
really
give,
feel like this would be better. And I was like,
I want people to get the best
Best
value
treatment.
and the best treatment, the right thing.
yeah, for them specifically.
If it's worth doing, it's worth doing right.
Yeah.
And
Your
so
dad just smiled.
maybe he's even watching. So the treatment plan that we recommend and we put together for you, if it has the word plus in it, it's because your provider believes that that's the right treatment for you. And now we're calling it a plus instead of a 4-on-8, which I would have called it a few weeks ago. I just would have called it a 4-on-8.
Yes.
So you're not being sold into something.
Yes.
Somebody just said something. Jealous, Tony. I'm still saving up. We had a lot of patients. Guys, we had a patient who came back to us the other day. We met 2 years ago.
Yeah.
2 years ago, and she just got her 3-on-6 just a few weeks ago.
Yeah.
So it can be a long process.
It can be a process.
We're not going anywhere.
Yeah.
Don't feel bad about that. Like it does take some people a little bit longer.
That's been the story for a lot of our patients. They had to save up. They had to work on their credit. They had to, whatever it is, and pay down some debt. I mean, there's so many different things.
Okay, so 3-on-6 plus. Then we got to answer one question. Then we got to tell people who we are, and we got to go away because I end these on time. Okay, so you don't have to have a 3-on-6 plus. You can have a 3-on-6 plus. It's new terminology. Don't overcomplicate it. It doesn't need to be mysterious, but your provider has the skill set and the ability to help make the best recommendation for you. So if he or she says 3-on-6 plus is the right thing for you, it's the right thing for you.
Yes.
That's what's going to give you the best foundation and the best outcome. If your provider never uses the word plus during your consultation, he or she has decided that a traditional 3-on-6 is the best treatment option for you.
Completely adequate.
Completely adequate. Okay.
Yes.
All right. We have a question real quick. Hi, everyone. We got home late last night. Thank you for changing my life.
We love you, Christy.
I should have read who the name was.
We love you, Christy. I love that. I love that.
You're welcome.
You're welcome.
I love that. That's going great.
You're
Okay.
welcome.
Bailey wants me to make sure to tell everybody. We have hundreds of videos.
Hundreds.
On YouTube. We talk about everything you can think of. We talk about surgery,
Instagram.
recovery,
Instagram.
so many videos on Instagram. If you like any of this stuff, please follow us on one of those platforms. What we have found is it helps more people find us. I'm a terrible salesperson.
Yes.
And we are all about doing the right thing for people so that they can be the best testimonial for us and helping other people find us. And it's genuine when it comes from somebody else. So when you see our videos, when you see people talking about their experience and what they have experienced with 3-on-6, that's genuine. You don't need to hear it from me. You don't need to take it just from me. Take it from the patients who are going through it, who are in it. So the way to find more of those like-minded people is go watch our videos, find us on Instagram, find us on Facebook, find us on YouTube, find us on Reddit, and we are at All Out Dental. What's the phone number, Tiffany?
702-710-9006.
Perfect.
And if this isn't for you, share it with somebody else that it might be for.
Yeah, you never know.
It's crazy. Somebody sent my my dad the video. Was like, hey, have you looked into this? And he's like, my daughter does.
He's like, that's my daughter.
That's actually my kid. Yeah, that one's
cute.
mine. And it was funny because then the guy was like, oh, yeah, that is your kid. I was like, last time you saw me, my hair was long. It's been a while.
That's actually funny.
Yeah.
Guys, real quick shout out. I act like I know what I'm doing here. I really don't. In dentistry, I kind of do, but we have an entire team that puts all this stuff together for us. And Bailey's behind the camera doing an amazing job and keeping all of us on track and keeping everything going with all the technology stuff and all of our social media platforms up. So Bailey, thank you so much. Behind the scenes, there's somebody else named Alex.
Thank you,
and
Alex.
She's not in the room right now, but she works so hard in keeping all this stuff working. So I'm nothing without the team that's around me. Big shout out to you guys. And if you are considering full mouth reconstruction, it would be an honor to help you on your journey. So if that's you, reach out to us, schedule a free consultation. We'd love to help you.
Sweet.
Anything else you want to close with?
Happy freaking Friday.
Happy Friday. Let's go do something fun.
Yeah. Oh,
we're actually
we are.
We're going out tonight.
We're going out tonight.
Celebrating a birthday.
Celebrating a birthday.
Yeah, Miss Daisy's birthday.
Dirty 30.
Bailey, anything else you're supposed to add?
Nope.
Okay, all right. Thanks, everybody. We'll see you in a couple weeks. Bye.
Woo-hoo. I'll have a haircut next time.
I'll shave.